Vision Care. Vishwasaniya Dekma.
බලන හැමතැනකම දැන් විෂන් කෙයා එකක්.
10 more recoveries were confirmed during the last 24-hour cycle, increasing the number of recoveries up to 569. The number of active cases under treatment now stands at 442, with the confirmation of 28 fresh cases today. The new number of infections has now surpassed the 1,000 mark to stand at 1,020. Meanwhile, 5 more sailors recovered and were discharged from hospital, bringing total naval personnel recoveries to 209. In the meantime, 11 cases were confirmed yesterday, and out of the 11 cases, 10 are Navy personnel, while the other remaining was a recent arrival from Singapore who was under quarantine. In another development, 2 Navy sailors who participated in the Guard of Honor rehearsal for the War Heroes commemoration ceremony have tested positive for COVID-19 yesterday. This was confirmed after PCR tests were conducted on naval personnel participating in the rehearsal. Steps were taken by the Navy to quarantine 30 other sailors. In the meantime, the oldest patient infected with COVID-19 has recovered and been discharged from hospital recently. The 94-year-old patient was previously transferred to the IDH hospital from the Velikanda hospital due to a worsening health situation. Meanwhile, in commemoration of the war victory, the staff of the IDH hospital organized a musical event as a tribute to the naval personnel obtaining treatment at the hospital. Meanwhile, 98 people who completed their quarantine process at the Palali Quarantine Center left for their homes today. In the meantime, Minister of Health Pavitra Vaniarachi addressed the 73rd Annual World Health Assembly, where she stated that Sri Lanka stands ready to share experiences with the international community on the COVID-19 fight.
At the outset, on behalf of the government of Sri Lanka, let me appreciate the leadership of Dr. Tedros, Director General of WHO, for excellent guidance provided during this challenging time. Sri Lanka has a well-established primary healthcare infrastructure. I would like to emphasize about the present pandemic of COVID-19. While giving focused attention on controlling COVID-19, we are determined to provide our continued care for other diseases, ensuring smooth conduct of healthcare services in Sri Lanka. Sri Lanka is committed to share our experience always and learn from best practices to save lives and finally to control the pandemic together with the global community.
Lever Ayush Karabu Neti Dantalepaya Shaktimat Datti Palakata